Hello and welcome to the URSA webinar, Coronavirus Conversations, Global Perspectives on Health Clubs and Physical Activity. I will now play a brief video.
As all of you know in this audience, physical activity is really important. It has enormous benefits, physical, social and mental health benefits. You all appreciate the importance of physical activity for nearly every system in our body, but also that health benefits lead to societal benefits. WHO recognised this and in 2018 produced the new Global Strategy on Physical Activity, a roadmap for all countries on how to increase levels of participation, for physical activity and a healthier world. It sets out 4 policy objectives and outlines 20 policy recommendations that are relevant for all countries to implement to achieve a target of 15% reduction in physical inactivity by 2030. We can look at that at the positive way, 15% more people more active by 2030.
At this point, I'd like to introduce Fiona Bull, Program Lead of Global Physical Activity and Prevention of Non-Communicable Diseases with the World Health Organization. Fiona, if you're ready, the floor is all yours.
Thank you very much indeed, and a very good morning to you all joining this WebEx. And I'd like to thank the organisers for the invitation to WHO and myself to join this important discussion we're going to have. I've been invited to provide a presentation on the area of work I lead at WHO, which is the physical activity work, and in particular to outline our global agenda on promoting physical activity. Ambitiously, I've got 3 areas I want to cover in around 10 or 15 minutes. Setting the scene for physical activity, which I know this audience will be very familiar with, but to put it into a health context, to talk about the new action plan and how it can involve you and your work, and also then to outline what's next for WHO and how we help the world get more active and support countries. And at this time of COVID-19, talk about how the needs of communities and the impact on the industry and communities is affecting us all. So first of all, greetings from WHO in Geneva. We're in lockdown. We've had 4 weeks of stay-at-home messages with some opportunity for some of us in Switzerland to still get outside and use the parks, though colleagues living in France are under more restricted situations at the moment. In the bigger picture, though, we have under our new Director General, Dr. Tedros, who you're seeing now very frequently on the news, 3 billion goals to promote health, keep the world safe, and serve the vulnerable. And that's very much in the prominent eye at the moment as we face a worldwide pandemic of an infectious disease. But promoting health during this is really important, and promoting physical activity during this is also important. It's important because we know the benefits of physical activity are particular to reducing chronic disease like heart disease, cancers, diabetes, managing weight, but we know it's also really important for promoting mental health and, of course, connecting with our friends and families. And those are all really important at this time. And we've positioned it, and you can see here the Sustainable Development Goals with health at the centre. But physical activity and the work we do in the sports sector, sport and health, is very relevant to many of those Sustainable Development Goals. It's a problem, which is why it's important we're all working together, because 3/4 of deaths are caused by one of those 4 areas I mentioned: chronic disease, diabetes, cancer and stroke. And that's affecting people in the very prime years of their life, 30 to 70 years, 15 million deaths a year. We know the evidence, and the evidence shown here on this slide is the more you do, the more is better. But there's a recommended amount shown bracketed between those 2 black lines on the graph. And there are many studies that show it's a very strong relationship. Being active can improve whatever outcome is on the y-axis. Often seen as all-cause mortality, heart disease, we can reduce risk, reduce the rates of death if we're more active. And really importantly is anything's better than none, a message we've got to keep getting out there now in COVID times so that people, even in their homes, are taking every opportunity to be active. You can see on the left a whole range of documents that are promoting and support that evidence, and right now we're working on updating that evidence with guidelines from WHO, which will be forthcoming later this year. The need is great. A quarter of adults don't do enough, and 3/4 of adolescents don't do an hour a day. So we've got a challenge regardless of COVID, and this slide set was pre-COVID. But now in COVID, we're wondering how much of impact it's having on people being active. Even if you're active normally, you're surely going to be affected, and that might make it harder to be active. And then we must look, as Walter in the next presentation will address, the post-COVID as things open up. We know it's a challenge because levels have not been changing globally very much. This level, the most striking thing here is the flatness of the line and the continuous gap between men and women, with women being less active. It's also a problem around the world, notably in high-income Western, US, North America, Australia, New Zealand, Europe, and also Caribbean and Latin America, as you see on the left-hand side. Again, blue and green, big differences between men and women, women being less. And of course, in some of the other regions where lifestyles, transport and recreation are still different, we do see more active regions in Africa, Southeast Asia. But they do change as economies advance, and we're seeing that flat line which we want to address. Which is why we have an action plan, and WHO was asked to deliver, link with the SDGs and accelerate action. We developed it over 18 months with involvement from the industry, stakeholders, academic, practitioners, whole community, and we set the ambitious goal of 15% improvement by 2030. The action plan is based on 4 pillars, and I think everyone on this call has got a role and a contribution to make in each of these 4 areas that I'd like to very quickly go through. The first area is looking at creating active societies, making sure people know and understand and value the importance of being active, and then understand their contribution in the sports sector, in physical education in the school sector, of course in health, but beyond, in the transport sector and in the environment, building the communities we want to live in. This is about education and promotion, and we're very good at it, but we have to have sustained messages, clear and simple calls to be active. These are generic messages, and right now it's about being active in the home during the COVID restrictions, but then getting back out and being active as soon as is possible. These are examples of some of the ways in which different countries are employing that sort of strategy. Mass media, simple messages, involving here on the top left, the Prime Minister of India is involved very much in keeping India getting fit. The second area is making those environments better, accessible places, facilities, affordable, safe. We're all involved in that as citizens, but also as facility providers and community designers. I mentioned the urban designers. We know it's a problem in different parts of the world to have access to safe places, to cycle, to get to parks, to enjoy safely the amenity of public open spaces, and in the workplace. We know what we can do to create the better environments that encourage the behaviours we want, and we need to employ all those strategies. Each one of these areas has got clear strategies, and they're marked on each of these slides, and they're available in Appendix 2. Here's where I think you'll find yourselves very much centre to providing the opportunities for everyone to be active, inclusive opportunities for people of all ages, all abilities, in and around their home, the community, sports, recreation, clubs, at work, etc. All those places. We're very good at this, but we've got to reach out and do more and make sure those who are least active, women, girls, older, are participating. And there's a sort of slide that shows us where we can think about the places and we can think about the groups we want to re-engage and support their ongoing engagement and being active. And what's important for the industry is to look at this and say, well, where are you doing well? Where could you connect and do more to help us address the inequalities, the disadvantaged, and ensure that everywhere has got that message of be active and look for opportunities, not avoid physical activity. Here's a slide I've used previously to show how important it is to promote to children. Those data I opened with are really staggering, and it really drops off in the adolescent years. So what we do in early years and encouraging them through tweens and then to stay active as young adults is really important. This is the business end where we have good policy, national governance, national action plans, surveillance systems to monitor participation levels, information systems that can inform and guide us into what we're doing well, how to improve, evaluation, and of course advocacy. Our voice being much louder and more effective when we work together in policy, in practice, in advocacy. When you put the GAPA together, you see it as a system color-coded here in this picture, where each circle represents one of the areas I've just spoken about. But it's not about one or two of them. For every country around the world, it's about building towards a comprehensive whole-of-system approach. More is in the Global Action Plan for you to read up about this, and we could highlight where I've mentioned you're involved in the yellow with opportunities, the data and evaluation and good policies for clubs and practice in the blue area, and of course accessible environments inclusive for all in the green environment, and advocacy and communications in red. We launched the action plan. I want to highlight Dr. Tedros on the right-hand side, saying it will really require all of us, all sectors to be involved and to coordinate to get the world moving. He's been saying that now through COVID. You see him wherever he can include this very clear message. It's important that we look after our health as we look after those affected by COVID and our healthcare workers as well, and the community. After launching that, our agenda became supporting action. And I want to work towards the end here by just summarising that there's a lot to do. We can see the major challenge, and we've set an ambitious goal. And this slide shows 10 of the areas where we recognise through our country offices and our regional offices, WHO, we need to work together to help in each of these areas. Some of those, for example, are absolutely promoting the partnerships, top left. Partnerships with the sports industry, partnerships with the sports sector more broadly, partnerships with transport, the environment and education, to make sure we're all on the same page, understanding it's important, but also connecting up our solutions so we can use the limited resources we have to best effect. We want to stop reinventing the world and share knowledge and experience so we can help disseminate, which is the second, catalyze with innovation and digital solutions. Of course, there's advocacy. Building training and capacity so that the industry can respond is absolutely important. I'm sure there'll be questions about the needs of industry training and across other areas, and knowledge and research. So I haven't got time to go into all of these, but I'm very happy to explore any of them which are of interest. And it's the programme of work WHO has now to take forward the implementation of the recommendations, which I might add, of course, are all evidence-based and generally regarded and very well accepted as the roadmap for the future. We have a programme of work which I won't speak to in detail other than to say that we are updating the guidelines, we have got monitoring underway, and we will be regularly reporting on the work that we're doing and progress made by countries to the highest level of our organisation, which is the World Health Assembly, every year, and widely to the community in the status report that we're developing on physical activity. We're developing tools to help people, and there's definitely work in the sports sector and recreation and fitness industry to help and share best practice. And we're working in partnerships. I want to extend my thanks to Ursa for being a valued collaborator and part of the dialogues we hold so we can share information about where industry is going and opportunities for collaboration. And a few of our other collaborations are shown on this slide. But COVID has changed the world dramatically in the last month, and we're responding at WHO headquarters and through the regional offices. Our key messages are to make sure that physical activity, being active, staying active, is heard loud and clear. 30 minutes for adults, an hour a day, and anything is better than nothing, of course, being a key message. But also, as we spend so much more time sitting and restricted into our home environments, keeping active by even those short 3-minute active breaks is really important. We're circulating slides through social media, which we invite you all to support and engage with us on. And we have a Q&A on the website that's on the WHO COVID website, where all of our information, daily updated across COVID and across keeping healthy through COVID, is available. We've got an agenda that's really challenging us all, and it's very nice to join you for this call to discuss that agenda and the solutions that are needed. I want to extend a thanks to URSA that's already responded by making many of your members, perhaps participating in this call, have responded by opening up resources, engaging and making sure that people know where to go and can find opportunities to help them and their families be active. And this is an excellent response, a very short time frame to make sure people can get and be inspired and supported in being active. And so I'd like to thank and bring to a close a rapid presentation under the context of COVID. It's really important we work together and we still have the common message about being active, everyone in the home, every day, and in all countries everywhere. So thank you very much indeed for this opportunity, and I look forward to questions now and throughout this session. I'll hand back to the organisers. Thank you.
Thank you, Fiona. Alex Larkham here. I have a couple of questions for you. You touched on it briefly in your presentation, but can you speak a little bit more about WHO's plans to help promote the importance of exercise while we're in isolation?
Yes, well, thank you, Alex. I mentioned briefly that we wanted to get some Q&A information that really would help governments who ask WHO for their guidance, and then governments can translate this into local languages and culture. But the clear messages are on the Q&A. Again, I direct you to with the message of being active and then ways to be active and directing to the sort of opportunities to be active, like the online and live streaming classes and materials that many of your members would be developing and from other sources as well. So we're making sure the message of physical activity is out there. We're also doing some challenges, and Dr. Tedros has identified 5 areas, one of which is physical activity, and inviting through some of the leading change makers of our world and through leading footballers. You may have seen a partnership with FIFA who are calling us to be active every day. We're looking for ways that we can amplify and get that connection to people who are finding it very difficult at the moment, but would get much benefit from physical activity. So we're doing a range of things directly from headquarters, and our regional offices in each of the 6 regions of WHO are complementing that and also responding to requests from countries. This webinar is an important opportunity to discuss, and we're likely to hold webinars from WHO on key topics. And of course, WHO is holding media briefings to communicate about the challenge and about COVID every day. Thank you.
Yes, and as I noticed in your answer, you mentioned, the virtual offerings. A lot of clubs have moved their operations online. They're offering classes and training and other services virtually. And you, as we were speaking through GAPA, you touched on making sure we reach those vulnerable populations who are less likely to be physically active, people with chronic disease, disability, women, older people, children. Can you speak about some things that clubs can do to see that their offerings are accessible to those people? Are there any WHO resources that would help them through that process?
Yeah, thank you, Alex, and it's an excellent question. There's no WHO resources, as we're not a provider of direct resources in that sense. But of course, the industry has got huge capacity and knowledge and experience in this area. I think your question really picks up on an important point. Those who are already active are most likely to know where to go and how to find things that meet their needs, albeit constrained to being in the home or restricted. Our concern is those who perhaps are not so active, they're not regularly going to the clubs, they may not know that your resources are available. So we're going to have to reach out to communicate to new constituents, really. In your specific questioning, there is a concern about whether the offering is at the right level, the right intensity, the right speed for people who are older or less active. Now, I know it's out there. My background is as an exercise professional, a teacher and trainer myself. We all know how to do those adapted programs, and to invite those who are less active, a bit cautious, perhaps overweight, a bit concerned about injury. I know the industry can respond. There's innovation, creativity, and I'd invite you to make sure you really promote those resources so it's those who are most in need can find those. And I invite you to think about how you can do that. It's a bit of a challenge, but I hope you can find ways to do that to reach those people who really need those resources. Thank you.
Thank you, yes. And I have one more question from you, from Caitlin in Wisconsin. What does the Club of the Future look like? This one is for Fiona or Walter, but I'm going to ask it to Fiona now, and I'm sure Walter will catch it later. What does the Club of the Future look like, and what should we be considering for when clubs can reopen?
Wow, that's a big question, and I thank you for it. I'll have a go now, but I'd like to hear from Walter too and be informed by his presentation. You're challenging me because I think even before COVID, I would have loved this conversation with you, because the clubs of the future might look different in how people pay for being a member, so making it more options and easier to come in and vary what you do to reach to more users, retain members at higher volumes. I think there was a real opportunity and a call from GAPA for the industry to take stock, because collectively the world was not active enough. That was my first few slides of the data. And chronic disease is the leading cause of death and will remain so because of our lifestyles, and we're not active enough. There will be changes, but I hope that there's some changes that will be positive out of this. I think clubs can move beyond the four walls and be very much engaged in communities in different ways, and very much more connected with the local and national agenda on promoting physical activity, a real partner in the agenda. So I'm looking forward to discussing those changes that would and should have occurred anyway, and are going to be prompted within the context of COVID for a rethink and to learn now from Walter about how that is already in process from the context of China and elsewhere. Thank you.
Thank you. Thank you, Fiona, for your time. I'm going to hand it back for Walter's part of the presentation.
Great, thank you. At this point, I would like to introduce Walter MacDonald, Director of Fitness Operations with the Caddick Wellness Group. Walter, if you're ready, the floor is all yours.
Thank you very much. First of all, thanks for the opportunity to share our journey so far. I really hope it goes some way to helping others. By no means we are saying you should follow this. It's just the way that we did it here, and our efforts basically to navigate our environment. You're welcome to use any materials that you see fit, and presentation. This is our company introduction, so you can read that as I'm talking. So just to familiarize all, we're based in Shenzhen in South China, literally on the border with Hong Kong. Shenzhen is a technology center in China, and a population last reported at 12.5 million. And you can read our company introduction there. So basically we have 52 clubs, but 17 fitness clubs. It's our 25th anniversary year, and our CEO Lonnie is one of the 4 nominees for us as board directors this year. But a lot to get to, so I'll get started. I listened to Colin Grant's really interesting sharing experiences, in particular the situation in Shanghai. There are similarities to here, but there are differences which I want to highlight. First of all, I just want to quote Joe Moore and a piece that he wrote on February the 8th for the recently published April CBI. He said, "See how much has changed by the time you read this and compare it to what was to what is." This is true for all information right now. It becomes old news very, very quickly. Things have changed here at such a pace. We've strived to be proactive, but also the need to be reactive cannot be underestimated. Even here we see more stability. There's still constant changes, right now for the good, but changes nonetheless. So what I've done is I've broken down to 4 stages, as you can see. closure, isolation, wilderness, and insecurities. I call it scramble phase for us, which I'll explain later. And then preparing for the reopening. So light, hope, and reorganization. And last of all, opening, new direction, new start. I won't spend too much time talking about closure because most of you are already through that, but I'll quickly share experience, which is slightly different and sets the scene for our challenges in stage 2. So with our closure, it's very different for us here. We actually close naturally for Chinese New Year holidays, and we're due to come back to work on 30th of January. At that point, we did know what was going on with this, but we had no idea we wouldn't be reopening our clubs for 47 days, which is how long we were closed for. At the end of the week's holiday, it was clear we weren't coming back, and normal day-to-day routines and lifestyle would be changed forever. So effectively, all our clubs were closed down due to the virus. They were actually closed naturally and just didn't reopen. So suffice to say, we had no preparation time and no warning for this, and the fact that all our team had now spread back to the home provinces in China, and I was in Macau, made it additionally challenging. During Chinese New Year, there was a mandatory lockdown, thereby not allowing the mass migration from home provinces to travel back to the main cities. So Chinese New Year, there's approximately 3 billion trips made between the 21st and the 1st of March. So obviously the Chinese government didn't want these people returning back to the big cities and making the virus worse. Stage 2, isolation. Basically everyone had to scan and report their travel history on apps whenever you ventured out for all necessities. Mask wearing, I know there's a split in different advice for people, but people wore masks here all the time, not because they were infected, but basically just to protect themselves. Obviously with the exception of coffee shops and restaurants, which were allowed to be open at the time. Social distancing, of course, became the norm here. And everyone's worn masks since early February, and we still wear masks now. So as I say, whatever your position is, at very least it's a physical barrier which reminds yourselves not to touch our nose and our mouth, which as we know how the virus is spread. For all our team members, we actually told them, make sure that your members know this, and all the information was out there already. And also another thing to consider was the supply. So I believe there's been shortages in the world of masks, and people want to save them for frontline care workers, but here wasn't an issue for us. So all of our team, Lonnie and the management, have daily communications. The first thing we focus on is basically how can we work effectively, efficiently as possible as individuals when we weren't able to meet face to face. So for our homes, basically, some of you know who've got kids, the kids are stuck at home as well, so it's kind of an interesting working dynamic with the kids doing online classes and playing. So I set up my office in my apartment, working areas for the kids. The kitchen became the canteen, the living room was the reception, and the toilet was the best meeting room we could have because there was too much background noise. So a lot of the meetings I had there. I find as professionals in the business, we've become super self-aware. I wouldn't say paranoid, but maybe paranoid of our body systems, where the slightest headache, dry throat, cough, sneeze, brought about concern and worry. Who have been in contact with, did I touch my nose, my mouth, did I touch my mobile phone or elevator button? You can get totally consumed by this, and we did send out messages to our members to say, obviously we need to increase our personal hygiene, which should be good anyway, but just increase the frequency and thoroughness. Another thing we advised on at an early stage was to not become a news hound, as particularly pressing watching too much news. Update yourself once a day of the key points. And then if you had any urgent things, I'm sure your friends would let you know on your social media networks. Once we come to terms with the immediate future and got ourselves right, within hours we'd reached out to our members. We felt it was very important that we were proactive with this as opposed to reactive. So first of all, we explained the situation and how it affects our club usage, and secondly, what kind of content we're going to do, engage them and be active at home. We didn't lack ideas, and with the exception of a couple of new initiatives, we generally stuck to what our teams knew were delivering already, instead of trying everything and diluting our time and resources. So we just really boosted our existing initiatives. We took the form of daily communication articles, nutrition, mental health care, and two-way communication, so they could ask us questions. So the 6 things you'll see is not only the 6 things, but 6 main things that we did. So first of all, we established Member chat groups are basically club managers and PTs were tasked to contact their base, each club. The club managers reached out to generally all, and the PTs reached out to their clients by sending messages of support and tips on exercise, health, immunity, knowledge tips that were relevant to them. This was in conjunction with the official company general notices. So basically with 3 channels of communication with our customers. Also with the club manager, they had an existing group platform as well. Classes and sessions number 2. Obviously online sessions is the thing that everybody's doing right now, some better than others. But we shared at least 3 online daily group classes, Group X classes, focusing on strength immunity systems and also physical and mental. We used WeChat. WeChat is basically the same as WhatsApp platform, and we received 1.7 million views over the 47 days. Just for reference, WeChat's got over 1 billion users, so put into context. We also offered some short online seminars with the famous doctor, and again we raised over 1.17 million views for that. And finally, we got our PTs to share what they were actually doing at home to stay in shape, and how our members can best use household items for resistance, cardio, stretching, and we had about over 10,000 participants for that. We did offer chargeable content. As from our experience in the past, we found we offer something only as a free option. It's hard to get members to buy later chargeable content, even though it's superior. So we launched a 2-tier system from the start. I did hear Colin referencing, I did hear Colin referencing that they didn't want to go in that direction, but we choose to do both because basically analysing our previous members' buying habits. For our chargeable sessions, we held 21 days exercising check-in, focusing on fat reduction, whereby our personal trainers filmed 21 days of training videos and then shared one piece every day, so that people can exercise at home. We also sold class packages in the form of body shaping, Chinese dance and yoga. And the last count for these chargeable packages, we'd sold about 482 so far. Number 3, I shared a daily journal. So basically what I was doing each day at home. Personally, I found this very useful for myself, especially my daily 3 MITs, which is basically most important tasks of the day. This made me totally accountable to report the next day I'd achieved those. What I want to really share was that despite having no schedule to get out of bed for, it was important that we stuck pretty much to our normal cycle and not treat every day like a weekend. And we published this daily on our WeChat platform again, and we could views on our platform. Number 4, we already had an existing online shop, we call it Wellness Mall. We expanded our offerings on that page, highlighting products that boosted moods and immunity, and special offers and promotions for first-time buyers. Number 5, we tried to do as much social welfare activities as possible, trying to give back to the community, because that's what we represent. So we provided 90-day free fitness cards and free fitness health checks. Once the medical carers, fire service and police, etc., who contributed most could come to the club. This was more a community-based project and a community goodwill gesture, but it was a positive with our member base. And last of all, online competitions. There's hundreds of things you can do. We just did some fun things because obviously our staff were masked. We did competitions like guess your PT from behind the mask and so on, and also exercise challenges day to day. For rented equipment and loaned equipment, we decided not to offer this because despite much consideration, logistically it was too difficult and our clubs were locked down, so it was very hard for us to do, and also delivery companies were not operating at the time. Most of our staff are not in the city, as I mentioned, and obviously there's an injury liability that would be an issue. So it wasn't really an option, though we wanted to. We just focused on what we were doing and doing it to the best of our ability. For staff training, again, it would be a great opportunity, but we couldn't take that because they were far apart, and same for maintenance and renovations, we couldn't get access to our clubs. We also found, as probably as you're finding out right now, there's a total bombardment of content through email, social media platforms. So we were very mindful that what we put out on a daily basis was coordinated and also with a view of not diluting its quality. We also want to send a message of positivity, but to make sure it was only through our official communication channels. And for our staff communication with their members, there were guidelines that we issued to make sure that they knew what kind of content that was suitable and applicable. Most important thing was not to overpromise or promise things that we'd no control of. We were also very transparent at the beginning on our members' rights. And by doing that, we released some financial pressure on them. Basically what we did is automatically freeze all our memberships and outstanding PT sessions until such time we reopened our clubs. Our model here is quite different. We actually charge an annual membership fee up front. There's no EFT or direct debit system. It doesn't exist here. We also wanted to be very transparent as soon as possible with our staff back home. So all our staff were contacted and either took advanced leave, which was owed in some cases, and in some cases no pay leave. This was apart from our core team who were producing online content, IT staff and other key staff who could contribute during the shutdown. The government has provided relief measures, rent reduction policies and paid social insurances during this time and offered other easing measures. Generally with landlords we've found their stance on rent was pretty tough. We didn't really get any, if any at all, rent reductions. We're still negotiating on that one, but it's been quite difficult because obviously that's a major overhead for us. I just want to talk about a bit of online focus because everybody is thinking about or doing or actually already operating online content. As the outbreak eases within China and life gradually returns to normal, we are clearly seeing it's going to leave a permanent mark in the way that people work and live. It has accelerated the long-term trend and digitalization of education and work. There's a huge range of online fitness offerings out there already. Some are very credible, others are at best dangerous. And the daily school classes and online learning has become the norm for kids. However, I would say many of our members have missed our face-to-face interaction, which I'll talk about later, because as you know, we have opened up our clubs. As we're an industry that provides online content, it will remain part of the routine, depending on time and circumstance, and particularly if people travel, it's a very, very useful resource to keep in touch with their workouts. So emerging from this, I would say we're looking at a combination of both online and offline workouts in the future, which will only broaden our markets. We certainly, to some extent, have been forced into this, as I'm sure some of you have been, and that's one positive about the situation, whereby many of us have been hesitating about going online. In this period, many people have grown and will grow to like it, and for some time, and for some it will be the new norm for workouts. We have found it has kind of exposed the vulnerability of offline business direction, and there definitely needs to be a new online digital content, and there's no going back now. I think it will force many industries, not just ours, to devote more resources to make up their minds and go digital direction much sooner than they planned for, by way of survival and necessity, and develop a new revenue and service stream. Previously, I would say there wasn't much positive will or incentive to go online when most people's core offline business was still achieving required budgets. That, I think, has changed forever. And the clubs that don't fully jump onto this and revert to norms when the virus passes, I think will find it harder to thrive, or in some cases, even to survive. They'll always be playing catch-up, and for us, we did it properly. It's not something we can just give someone to do. We've actually hired professionals to help us with that. Even for here, the world's largest internet population of about 850 million people, there's still 540 million off the grid. So we can see the potential with this. Preparing for reopening. Our mentality was brand loyalty needs to be reinforced and not taken for granted when we started thinking about opening. So basically just like starting again, and take it that nobody knows us and what we stand for. We also took the opportunity and viewpoint of zero-basing each club and each department and work from there. So we basically identified the weak points, overstaffing. The opportunity that we looked at is introducing a new simplified salary system that promoted win-win for mutual benefit. We also addressed all these before reopening and also helped us put in place an important part of our reopening strategy. During this time, we spent a lot of effort on drafting new SOPs, like detailed staffing headcounts, specific facility cleaning details and frequencies, what chemicals to use, the procedures for staff and checking procedures when members come in, Also, we needed to refresh and retest all our software and other operating procedures because it had been a long time. We want to standardize these as much as possible and to share and pre-train all the clubs as soon as possible. We didn't know at that time what kind of ramp-up speed we'd be doing. But our main issue was the lack of staff at that point because they were still back in their home provinces. Being a first mover during this isolation phase was important. And sometimes measures that seemed drastic at the time, we now view actually as very prudent in hindsight. As we can't keep playing catch up, we have to get ahead of this. We had the time to do this and try to think as far as possible ahead, but had to continually alter plans because everything's quite fluid. Our whole strategy was to get in front of this and stay out in front as much as we could, control the things we could and just go with the things that we couldn't. People generally had gone into survival mode and little mood to go shopping. Basically buying basics, and that's it, as most had no income. This is natural, and the first instinct for all, including our members, was to save as much money as possible, and we understand it will take time, and then getting income again for our members to spend like before. The reopening was strictly controlled by the local government and national guidelines as when and what we could open. And only if we met the standards we were allowed to reopen, which included the selection of staff with evidence of good health and a full service history of returning to Shenzhen. As I say, everybody had an app which used the traffic light system of the recent travels, where we could prove disinfection inventories, all had to be proved to authorities. Government officials would also do random checks for reopened clubs. At the beginning, only members were allowed entry and no guests initially. During this isolation phase, we also considered underperforming clubs that we had in our group. Maybe we could close, consolidate with others. There were some that were coming to a natural end of their rental contracts or coming up for renewals, and there was no rental concessions tabled. So these are the types of discussions and conversations that we were having. What I'm showing here is basically the standard that we had for our main disinfection station, which was at the entry to the club. We had to do all these measures. You can read them for yourself. But these were the 12 things that we had to present in every single club, and we had to go through very, very strictly. I think you'll get those slides later on, so I'll move on to the next one. We decided to cover our cardio with cling foam wrap, mainly protect the LED screens from sanitizer and some excessive spraying and disinfectant. Sometimes can get into the screen and damage the equipment. And also the high-touch surfaces were easier to wipe down because they were flattened out. Most important thing was visible disinfection stations. We had two types of these, personal and machine disinfection stations. Basically, they became our highlights and our crown jewels right now and still are for our members. We did a thorough deep cleaning and disinfection pre-opening. We placed our welcome disinfection stations by the entrance, as I showed you, and placed at least 2 other highly visible stations in the main gym floor with hand gel, disinfectant spray, disposable towels. So our members were welcome to double down on already cleaned equipment. If they wanted to clean, they were more than welcome to do that, and they appreciated that. The members knew the club. The main thing they wanted to see, feel, and smell was tangible, intangible hygiene initiatives at all times. Reopening staff levels, we decided to set at 40% due to a number of factors: payroll, anticipated traffic, and the staff who had not been to the hotspots. Just really trying to minimize the people, as we and the members who did come were still very wary of groups at that point. Also, as mentioned, many staff were, and still are actually, at home in their home provinces, and some were not really willing to travel back unless they have obviously a job to come to. We also thought it was important to keep the same staff in each club and not rotate our team around, so when members returned, they were greeted by familiar faces. So number 4, opening. We decided to open our clubs gradually in batches, even though the government allowed us to open up all straight away. We based this thought on which club would get most traffic, so we opened up a residential club first, along with one of our high-end mall clubs. Also, that had a spa, and we could actually start offering basic permitted treatments as well. The reason for opening a residential club first was that we were still not permitted to open showers. so our members could come and return home and shower at home, so it wasn't too inconvenient. Needless to say, we didn't want to be closed down again, so we had to be really careful of our procedures with no exceptions and follow the procedures to the letter. And our staff did not permit any member in from any hotspots or travel history warnings identified by their app, as this might cause us to be closed down. As in Japan, Shanghai and Hong Kong, they'd recently had to reimpose the shutdowns, which must be really disruptive logistically for operators and very concerning for members who were returning. We can't control that outside our club, but at least a cautious reopening ramp-up schedule might minimize the effect, which means that if we do have to close, we don't have to close our whole club. These pictures are just some of our reopenings. Our operating hours, we initially set 12 p.m. to 9 p.m. There's not a large appetite for early morning exercise here, and we're sometimes limited by more access, opening up to 10 o'clock. But we started off at 12 to 9. We'll change those hours as we get feedback, but that was our core hours. So our first two clubs reopened on March 17th with only fitness area and PT available. No towel service, no saunas, no steam, no group exercise. No studios were allowed to be opened. Working out with a mask on, which we have to do, I have to say personally presents a huge challenge because it's like working at altitude, but also at the same time being waterboarded. It's extremely difficult to breathe, and you're basically breathing your own sweat sometimes. So we had to do frequent mask changes. For these two clubs, we implemented very strict standards and checked them carefully. And once we're happy with operating procedures, we could actually start thinking about rolling out more clubs. As Colin from Pure mentioned, we also followed a booking system because we were only allowed a certain amount of members at the club at one time. So we introduced a booking system of 2-hour usage windows. Phase 2, we reopened another 6 clubs on March the 26th with the same facility restrictions, but we could open our locker rooms now, but still no showers. Reopening again was based on training and staff challenges with logistics of actually getting back to the club. Phase 3, we reopened up another 4 clubs on the 1st of April, but now we're actually permitted in selected clubs to start holding limited studio classes in Group X, obviously with social distancing in place and maximum according to the facility size. And Phase 4, yesterday, we actually opened up another 4 clubs. So we've been pretty busy because our clubs are fairly well spread over Shenzhen. So currently, we're still operating all our clubs without showers, and none of our 4 indoor swimming pools are yet allowed to be reopened. For racket sports and courts, no doubles are allowed, only singles. With member visitation, of course, it's lower than before. I'll give you an example. For a club that we used to get 150 visits per day, initially we were only seeing 15 to 20% of that at the beginning. Through time it's increasing, but many of our members are still wary of coming in to exercise, and also they've got more important things, getting life back on track, sorting out travel, eating, and getting back to work. But we're now seeing more people getting back to daily workout routines. And if people have been living without the usual structure and discipline for 47 days, it's to be expected that it's kind of hard to get back into it. But our focus was to, first of all, ramp up our visitation from our existing members base. Since reopening our first 2 clubs, we have seen usage levels up to about 45% of normal now. And for us, visitation is the key metric. That's the most important thing for us, is just getting people back into the clubs. Those numbers don't include Group X numbers. PT bookings follow the same similar vein. Our PT focused on getting a general message out when our club opened, and then the PT and sales called up the members individually to inform them and encourage them to come back. Listen to the concerns mainly, no pressure, just a friendly call to say we're here, and whenever you're good, you can come back. Okay, this slide here, one of the most important things is that we filmed and shared members actually coming in, obviously with their permission. As well as them hearing about it, we wanted them to see actual members in their club working out. And also with relevant permission, we We did a little presentation, photo ops to some of the first members who returned to our club, and a short interview if they're willing to do that. We find this really helped in assuring other members it was not only safe to return, but it was time for them to return. Another idea, incentive to incentivize visitation, which you might want to use, either from the beginning or if you find it's a slow pickup after you reopen, is to promote batch offers. For example, the first 100 members who come back get a high-level gift or a win-win voucher of a slow-moving item or a new service. And say, for example, the second 100 get a gift but it's a lesser value. This, of course, depends on your club size and budget and so on. Overall, our selling strategies remain pretty much unchanged throughout the period that we normally follow. We insist on not doing huge offers that would basically damage our future market and would bore into the future, which is important for us, even though we're currently under financial pressures from the period before closure and obviously beyond. We did make some promotions, but reasonable ones according to the situation, and of course it depends on your current situation. So what's next? I've got some positives and negatives. Our next focus is basically to get used to, our staff to get used to new procedures, is to look at a fresh start, a relaunch, a reset, what it's going to look like, how we can paint a picture to our teams, and how we can stay better and not just slide back into default mode, which is easy to do. Once we have a more stable-based operation, we'll pick up those leads that we have on hand, because we have to change and update our sales presentations and pitches according to the changes. In that direction, we're going to continue developing our online free sessions, both live library broadcasts, and we're also in discussions to do members online live broadcasts, cooperating with some external health organisations locally, as we feel these times members want more expertise to refer to. So these are some of our objectives. I think we all should consider, or need to consider, and we certainly are, is incorporating medical experts embedded in the clubs. We already have some in our medical wellness facilities here, but actually making them more available in our fitness clubs with immunity programs and educational resources rolled out by the clubs and operators. We provide an essential service, and the members will return at their own time and realise the need for them taking control of their health. So we're very excited when we look into the future. And as painful as disruptive this has been, we see a huge surge in the health and fitness wellness awareness and the need for our industry. Here, many clubs and ventures have not and will not survive this due to their cash flow situation or stoic landlords, and as their models were weak during normal times and margins were thin, which means for those of us who do or plan prudently, there's great opportunities out the other end. It's certainly a pity, but I guess it will have the effects of consolidating the industry, certainly here, as it was becoming was very fragmented, with the saturation of club offerings appearing over the previous 2 years. Another opportunity is human resources. We found an unusual plentiful supply of quality candidates. We have obviously to replace some people who wanted to change career paths, but particularly ones from the travel and hospitality sectors which bring great customer service skills. So this is another opportunity to strengthen our team. Things are getting back to normal here, but actually we're not sure what that means. Major leagues like the Chinese Soccer League and the Chinese Basketball Association and mass gatherings like marathons will not resume for the foreseeable future. Schools are still out, and to be honest, I fully predict there'll be no more schools this school year. So that brings further challenges and pressures at home, where physical activity starts to take a back seat as it's left down to the parents to organise. I certainly found from my two at home, the school offered very little, actually nothing at all in way of exercise, tuition and advice compared to that of other online lessons. So it's a great opportunity for operators to fill that need as it's blatantly missing. This is a really worrying insight and kind of touched on what Fiona spoke about, as it's probably happening globally and as another topic for another day. We didn't cover this during lockdown, but in hindsight, it's another opportunity. So maybe it's something you want to consider when creating your online sessions. Also, by making them inclusive for the whole family, some parts for the grandparents, some for the parents, some for the kids, it would help bring the family together and certainly the kids off their devices for some time. It's been very challenging for us, to say the least, for Lonnie and the rest of my colleagues in the management team. We're kind of reluctant pioneers. We've had to navigate this first, with no real support or sounding boards to refer to or share with. and now we are again pioneers coming out of this. We're grateful pioneers, but despite that, haven't got a pathway to follow, so we have to create our own path. We're still very confident in the industry's future, whereby others who are in lockdown right now and other staff members out there can't really see due to what's in front of them. We're all going through these tough times, and sometimes it's hard to see the light. However, in our case, we're very mindful, as we're not through this yet. We can only take it day by day, hoping that there's no more cases, either imported or local cases. And we look forward to seeing the borders reopened again and people travelling. For the global initiatives like Earth's initiative for 230 million members worldwide by 2030, and also like Fiona spoke about passionately, the WHO GAFA Let's Be Active campaign, in the space of a few short months, the whole landscape has changed, and I feel in favour of both of these. Both are eminently achievable due to this low global wake-up call for the powers that be, which is an extremely exciting prospect for us all. I feel we have, but we still need to unite like never before through our representative bodies to voice to the powers that be around the world and to make sure that they give full support to our industry so it's not too beaten up when we come out of this. We have found particularly we're a very important pillar of the healing and recovery process and beyond. And our communities and members need us like never before. I, for one, am really looking forward to the URSA Convention 2021. It will be a momentous event. As we'll see our colleagues again, even though we have not met or actually know them, we'll be able to see in their faces and all know we've been through something similar together, shared the same or similar unprecedented situations, and come out the other end, changed but together, and that we've all performed a noble, righteous and essential service to our member bases. Lastly, we find our leadership attributes have been very important during this time, facing challenges with determination, solving problems creatively, solving problems collaboratively, and just by making fair and just choices, applying current situation knowledge with compassion, and just contributing positively to the community and do something kind for someone. That's what we've all tried to do during this period. We feel for all countries. We know what you're going through. We've been through it. And the club business worldwide is suffering from the outbreak and the total disruption. But here we're in a position right now that we could have never imagined to show direction in this with regards to reopening our clubs and hopefully giving light and hope to everybody out there, which I trust this sharing has been positive and given you hope. And there is an end to this. I'd like to thank URSA, in particular Christine, Angeli, Killian Fisher and John Holsinger for inviting CW Group and myself to share our experience over the past few months. And if you have any other further questions or anything, please reach out to us. And with that, I'll pass it back to the US. Thank you.
Thanks, Walter. We do have a few questions here for you. Do your trainers, training clients count towards the reservation system and total head count? Do your clients and trainers have to book in the booking system that the general member population does?
If I heard you correctly, yeah, we, as I said, for our normal usage, people have to book ahead because we're limited by the amount of people in the club, and we do 2-hour cycles. For PT is exactly the same. Most of our PT before this was actually booked online anyway. People just didn't turn up or called up on the day. It was booked ahead of time. So I think, does that answer your question?
I believe so, yes. Next question. You mentioned your members have to work out in masks and then they have to change their masks frequently. Is the club providing the masks for the members themselves?
Yeah, we do. As I say, it depends on the policies that the clubs have, countries have, but here there's plentiful masks, and it's one of the things that we wanted to offer our members. In particular, as I say, I know the experience when you work out. It's very difficult working out with a mask, but it's essential. There's no other way. And when it does get sweaty, as I say, it's extremely uncomfortable, let's say. So we do offer changes of masks, as many as they want, just as a service.
Okay, how has your member retention been impacted? Did you lose many members, and how are you working to regain them?
It's a bit hard to quantify right now because our members are still coming back. So any data we have doesn't really give the full picture of our retention figures. I think once we start to return to more normal club operations and further down the line, we'll assess it and start to see more accurate trends. But so far, we don't anticipate, or certainly seen so far, any real negative effects.
Okay, great. What are your recommendations for slowing membership cancellations or freezes? How can we best communicate with our members?
Okay. As mentioned, we naturally froze all our memberships and then reactivated when the club opens. So basically, we added the period of closure onto their original expiry date, and that includes for PT as well. Best communication channel, as I mentioned, is WeChat, which is a go-to platform for everybody here. We took a very proactive stance to allay our members' concerns before they started saying what's happening with the membership. So we tried to get ahead of their concerns, so we anticipated their needs. But as I say, the membership was frozen automatically and then unfrozen when their club opens.
Okay, great. What are your recommendations for social distancing within the club once we can reopen?
There's varying guidelines. For us, it's 1 meter, but I've seen in the West it's anything from 1 to 4 meters. So obviously, maybe it's due to wearing masks here that everyone wears masks. We can get closer, I'm not sure. But if it's the club environment and it's 4 meters, then it's maybe not feasible to open your club or realistic to operate. Depending on the size of the club and erring on the side of caution, I'd say we don't want to concern members, but we've set a maximum of 30 per cycle for now. But we plan to increase that when conditions allow. The main issue is, for example, cardio equipment is pretty much jammed together side by side. So we've taken out at certain times every second machine to actually have natural or forced social distancing.
Okay. What are your quick tips for reopening the club in phases, considering things like swimming pools, childcare, group exercise, etc.?
Okay. Yeah, as mentioned, we opened up in phases, mainly so we had more control over things if we had any setbacks, because we weren't sure what the government policy was going to be. So we had to be very cautious with that. And there was a lot of uncertainties. None of us wanted to reopen too many at one time and then be closed down for not strictly following the procedures or very few members coming in. Of course, it depends on the type and what size of facilities you first select to reopen, but it's down to each operator and their environments. For pools, as of now, as I say, we can't open. We're not permitted to open. And the clubs that do have kids' play areas embedded in them, we still haven't actually opened yet.
Okay, and this will be our final question because we are getting towards the end. It's the same question that we asked Fiona earlier. What does the club of the future look like? What should we be considering for when we can reopen?
Yeah, I heard the question for Fiona. A challenging question for me as well, probably anybody, but I'll give it my best shot. For what you should be considering, I think I've answered most of those things already in the presentation, but I would say everything. You have the time and probably the financial pressure to analyze every detail of what you do and what you stand for in the community. I would say you stick to your core values, look to or remind yourself why you started in this business and what you can deliver, but also more importantly what your teams are capable of delivering to your members. Some clubs here and other clubs I've heard of have taken a kind of scattergun approach, maybe out of desperation of seeing other clubs doing it and just following and trying to do totally new programs, but only communicating these programs through virtual communication. It's quite a risk communicating on video conferencing and so on, because the understanding is different. This, I would suggest, is not the right time or strategy. The club of the future, again, that's a big question. I wish I knew. What I would say is, when the situation allows, it's important we do reinvest. I know for some of you hearing that, that's way too far down the line. But an essential part of our business is the new. We're always innovating ourselves. And a major part of that actually is the equipment manufacturers we all seem to actually have forgotten about, as I haven't heard anybody talking about them. They form a crucial part of our business through equipment and constant innovation. So I'd encourage all of us, when we can, when we do start to get some more cash flow in and regenerate our business, is to work with them and look after them, because they've been an important supporter of certainly our brand and company over the years. I'm sure everybody else as well. Thank you.
Great, thank you. That is all the time we have for today. Before you shut down, please take a moment to fill out the survey you should see on your screen momentarily. We do appreciate any feedback that you can provide to help us improve future webinars. Thank you all for joining us today and for your interesting questions. As always, thanks also to our speakers, Fiona and Walter, for sharing their expertise. We hope you all have a great rest of your day.